Hey, I am Don Arnoldi. I am the Executive Director of the Process Therapy Institute.
I'm Dmitry Wolfovich. I'm a licensed marriage and family therapist and one of the clinical directors at the Process Therapy Institute.
Svetlana Kramer, a marriage and family therapist, and another one of the clinical directors of the Process Therapy Institute.
I'm happy to do that. I have to start in a different order. We are not an agency, okay? We are a training institute, and that makes some differences in how we operate. Our mission is not to serve a particular client population. Our mission is to improve the practice of psychotherapy and specifically to help people wanting to enter the field to become competent and caring therapists. While we see clients here, that's the context, not our purpose for being.
Yeah, and I would also like to add, as far as part of the reason why we don't really specify any kind of population that we work with is that we kind of operate on a holistic principle, so that you know, whatever symptom that the client comes in with and whatever population, we sort of work with the underlying process, which sort of transcends demographic. So we work with more of a process oriented. So, you know, whether it's grief or abandonment or, you know, anxiety or depression. So we try to just hold space for whatever the underlying process is. So we don't really try to focus on any specific population.
If I may add, just for clarity's sake, the way we practice is more similar to a private practice model, in that the interns will be expected to advertise themselves while we advertise as agency as well, but mostly people will come like in a private practice. People will come with all kind of presenting issues, and clinicians will be able to choose what they want to focus on, what populations they want to deal with, or however broad, spread the net, however broad they would like.
Depends how you define client work. If you're talking about only what happens in the therapy room, then there are a bunch of things. We are a training institute, so there is ongoing 2 hours a week of training, in particular mirror training, which is where you're in the room with a client, either actual or role played, and the supervisor trainer is watching through a one-way mirror and giving you feedback through an earpiece. Of course, we've translated that to Zoom for the time being, but we actually do have rooms with the mirrors. There is 2 hours a week of group supervision. And then there are all the things involved in operating a private practice, because as Svetlana said, we operate from a private practice model that the therapist has to do. They have to participate in client acquisition. They have to do intakes. They have to set fees. They have to schedule the client. So negotiating times and availability with the client. But from my point of view, that's all client work. How you deal with the client outside of the treatment room is as much part of client work as what you do in the room.
Yeah, and I'd like to add that what we do is when we onboard them, we sort of have a series of classes where we kind of prime them and hold their hand with regards to some of these logistics like paperwork. So we're kind of teaching them how to basically case manage and hold caseloads sort of on their own while we kind of monitor them. So we're signing some of their paperwork. We have a client coordinator who's you know, funneling some clients that are coming in through the agency. But we're also helping them to set up a Psychology Today profile. We have a profile on our website with their picture and information. Maybe we encourage them to also create a website. So we kind of we assist them to be self-determined in their process while still being kind of, well, technically employees. of our agency. Yeah.
If I might add, we do ask them to participate in the community. We have all hands meetings once a month where we talk about agency-wide situations. And we really, like, our client coordinator is just another one of our trainees. So we do invite them to be as active in agency as they wish to be. There is also a class that is required where we get them acquainted with the process model, which is basically our lens through which we do therapy. So there are two ways, as we mentioned, there are two ways the clients come to PTI, and one is reaching out specifically to one of the practitioners because they advertise on Psychology Today. They might be part of some listservs. They might create some networks, referral networks for themselves, or do groups or whatever. We encourage them to do what the private practitioner would do to invite clients to come. So in that sense, it's very similar to private practice. They get a call, they chat on the phone for a few minutes. Once they realize that the client is willing and able and can afford them, they meet, they schedule and they meet, and assessment happens in the session. We have paperwork. We are not heavily paperwork oriented, but we have a paperwork about assessment and treatment plan for them to practice gathering information and having some clinical, making some clinical sense out of it. But it is not the focus of what we teach them, in that we encourage them to jump in and continue. I believe assessment continues as we see clients. There is an assessment at every session. There is an assessment at certain points of the process. So it's mixed with the clinical work as we know it. And the second way the clients come is through the agency when they call the agency-wide number. Our clients coordinators meet, or on the phone or Zoom, meet with these people who are looking for services and explain to them what we are, invite them to be part of the mirror program, or figure out what are they available for in terms of times and fees, and if there are any special needs, and send an email to practitioners. Like, we have such client who is available, and then people respond with availabilities, and one of them will get assigned the client. And for clinicians, it's a great way to practice. So the client doesn't know who they are going to be assigned with. So sometimes they have some resistance, sometimes they wanted a man, but they got a woman, or sometimes, they want someone really experienced and they get a student. So I find it a great practice for students to learn how to create a fit. The fit is not a given, but the clinical fit is something that is created by joining, listening, being present, and just showing up. And surprisingly, finding a fit and finding a rapport at the end of that process.
For the mirror portion of is where we teach them live. We give them live supervision through a one-way mirror or through Zoom, where we give them instructions about how to perform psychotherapy in real time. In those cases, we like to just give the students a client, and we just say we assign it so that they could just experience something new. And so that's one kind of funnel. And then obviously they're also kind of building their own identity in the therapeutic world, and they're also finding their own clients on their own. So those are a little bit different because they can also find their own niche, and people will seek them out, in ways that they prefer. But we also, there's two ways that they can get clients, basically. Yeah.
I don't know that there is so much as typical. There are some averages. We do not assign clients to trainees, we offer them. So how many clients they see is, for the most part, up to them. We set an expectation that they will see at least 2 a week. We encourage them, invite them to see more. Some of our associates and some of our trainees even are seeing 10 a week. But because we don't have a client closet, and our mission is not to make sure that all those clients get seen, if they have a home problem, if they are doing finals, if they want to go on vacation for a week and they don't want to see a client, that's all part of their case management stuff, and we don't beat on them about it. I would say average number of people at this point, the average number of people being seen is about 3. We have a handful that are seeing 5 or more. And we have a few people that right now, because of various things, aren't seeing any clients at all.
Our program is sort of geared towards more of mature kind of entrepreneur, people who would probably prefer to be in private practice and want to start their career off on that note, instead of going to sort of more agency, or hospital setting. And so we kind of, we do support, but we also try to encourage self-determination. And usually it comes with sort of a timetable so that, the first several months, they're getting a lot of the training, they're taking the classes, and that usually they may not be seeing, we give them a client in the mirror program, whether it's a practice client, so they are able to get some of those hours for the BBS. But usually it takes, maybe 2 or 3 months for them as they start to, market themselves and create a profile and stuff like that. It takes some time, and usually after, 3 or 4 months, they start to build up, and they get, they can have more clients, and some of them reach a point where they reach okay, I can only do 10 a week, and that's too much for me. So we kind of, as a disclaimer, we want students to know that are watching this video that, with our program, we are not going to hold your hand as you kind of build your caseload, but it is very possible to get all your hours. You just have to be self-determined about it, and know that you're not going to get a full caseload on the first day you come in. So. Our supervisions are 2 hours. So they're kind of grouped off into a 4-hour training period. So that's the first 2 hours is supervision, and then the second 2 hours is the mirror training portion. And so what happens is when you start at PTI, you're naturally kind of encrypted into doing a year-long mirror training. Which is meaning that you have to, for a year, you have to go do the 4 hours, so 2 hours of supervision and 2 hours of mirror training, where you're seeing a client while being given live supervision, in 1 hour, and then the other hour you're watching one of your colleagues do that. And so you have to do that for a whole year, and then you kind of get this more or less like a certification and this experiential. We do sort of this Gestalt somatic psychodrama style of therapy, and so we give this strong training. And so you have to, and once you're done with a year, then you can move to just the 2 hours of supervision, and then you don't have to do the mirror portion anymore once you've graduated out of that. And then we also have students who see more clients than per unit of supervision. So then we also offer individual supervision and or triadic, depending on what we have. And so some students they go to the 4-hour group supervision and mirror program, and then they also do individual supervision with one of our supervisors. And that's how it's structured pretty much. And we have 4 groups right now per week. So our training structure is, we have Padmini who actually takes the lead in organizing the classes. And so we have, the first class is called the basic process class, which is a 10-week course with 3 hours a week. And we go through kind of the basis of our model. And then we also, during that 10 weeks, we also offer other classes. We call it nuts and bolts, which has to do with marketing and clinical, like note-taking, crisis intervention, reporting laws and stuff like. So we do a pretty comprehensive training along with our experiential model of therapy. And then once you've passed that, we also have an ongoing advanced process class, which is for those who kind of want to study further and take kind of go deeper into our model, because we have we have a whole binder of charts that we teach our students.
Before online started, we had every month or twice a month what we call the brown bag series, where people, but this is optional, it's not required, but we try to create a lot of opportunities for people to come and learn, like during lunchtime on Fridays, or right now we have this mini conferences, a series of mini conferences where people can participate and learn from for like half a day on a weekend, once every few months. Come and be part of a community, and they can actually, I guess a part of the model is that as you learn, you also teach. That's how I think we as humans learn. Some of it by listening to others and doing, and also then by teaching others. So they can become teachers on, say, brown bag series. And if there is a theme they are passionate about, they are absolutely encouraged to go and do workshops or any kind of lectures on their own as teachers. So.
Yeah, and also the students who take the advanced process class, which is the next level clinical training, we also, once they are in that class, they eventually go and we facilitate them teaching the basic process class too. So they're kind of, the more advanced older students are teaching the younger students. And we offer opportunities for people who, after they pass the advanced process class, to eventually want to become a supervisor with us or become mirror trainers. And then we also started recently a podcast series that we're putting out on online on Facebook and YouTube and stuff, and where the clinical directors are, we join together and then we talk about things related to experiential psychotherapy, and we're inviting the students to come and participate with us as a way to give them opportunities to practice, public speaking and being an expert in certain areas of psychology that they may be interested in.
Ordinarily, we have a group of what we call therapists in residence, which are licensed practitioners. To some extent, it's an incubator for people who got been through our training and are starting their practice, and they come in and rent space from us by the hour until they build up enough of a practice to afford their own space. We also have a group of people who are at the end of their careers and are scaling back, and so they've given up their full-time office and are here. And there's an awful lot of informal learning for trainees in the building. And it's like, well, my supervision group isn't for another 3 days, and I've got this thing, who can I talk to? And there's generally a lot of people in the building, experienced people in the building with whom they can consult.
We put a large emphasis on sort of ownership, and we teach our students not to try to understand the client and try to be technicians and try to be advice givers or figure out, diagnostics and stuff. What we try to do is we try to prime and teach our students to be more introspective and inquire more about themselves so that they can be a better instrument. So we always, when in supervision, when the students talk about clients, we always return the attention back to what is it like for you in the room? What are your hangups? How can you be more present and authentic for yourself, so that we make it more about the student and how to be more present and grounded than so much about figuring out the client. And with that said, you know, what a successful student implies is somebody who's willing to look at themselves, willing to be authentic and mature within themselves.
Open mind and ability to see and reality check with other people observing you, or even maybe giving you some constructive criticisms, I think is super important. This the ego strength that requires to just tolerate the fact that, you know, there are other people observing you, and you might not initially have no idea what you're doing and hear people saying, and that's okay. So that I do believe that's required. You also mentioned, Dmitry, before, the self-determination and ability to self-motivate and self-introspect. So all of this, I think, is essential, yes.
Those things that we kind of mentioned are related. So sometimes, you know, students may come in with maybe an expectation that they would have more hand holding from us, or that things would be maybe provided. So that as well as group dynamics, I think maybe some students may not come so prepared to maybe take ownership, and sometimes they see that the group dynamic as challenging because maybe people are blaming each other. And so we see it as all a part of a learning experience to facilitate group process. And so sometimes that sort of space of ownership can be a little bit challenging for some who are not prepared.
This requirement of market yourself and get out there, and some people come and expect you give me clients, and no, you're going to go and get clients, and you're going to show up for that. Also, I think there is this concept which I keep repeating to my students, like a parrot, really, that there is nothing you can do right and there is nothing you can do wrong. It's all very contextual, and it is up to your client what they make out of it. As long as you're present, and letting go of agendas and just being in your authenticity, that is good enough for me. This is what I believe is being a therapist is all about. And for many students, it's a pretty challenging idea, because we are so used to be right or wrong, and we are so used to be like have these boundaries. There are some legal and ethical boundaries, sure enough, but that said, there's a lot of things that I keep saying, well, you determine your boundaries, what's right for you. And sometimes it's hard. For people who used to external validation and really need it, I would invite, I think it's a beautiful growth opportunity. That's where, you know, they can learn to let that go and start looking inside more than outside. But it's not easy.
I keep coming back to a Brene Brown quote that I love. You have to be willing to take off your armor and enter the arena anyway. And to the extent people can do this, they succeed. And to the extent that they resist it, they struggle. And that's kind of how we are.
I would want to say, come on, let's have fun. A big part of my spiel is that therapy doesn't have to be like painful, boring, doom and gloom. Yes, it's there, the grief and the pain, and there's a lot of creativity and excitement and engagement and just playfulness. So yeah, I love CIS. I myself came from expressive arts program from CIS. So come and let's play. That's what I want to say.